We have a nice big group here today. American Democracy Project is here today partnering with the National Alliance on Mental Illness to bring you from the History and Philosophy Department, Dr. David Tostenson, who's going to examine some of our perceptions and beliefs around disability. So I will let you introduce beyond that.
Okay, sounds good.
Thank you.
Okay, well, thanks for showing up. And thanks to the American Democracy Project and to the National Alliance on Mental Illness. So, I guess first things first, I want to say a little something about what I'm doing here and how I'm doing it. So, I mean, to state the obvious here, I'm not a medical doctor. I am not a physician. I am not a psychologist or a psychiatrist or anything of the sort. I'm not any kind of empirical scientist. By training and the philosophy program here, we are housed with the history and philosophy program, and I'm in the department, but I'm in the philosophy program. And I want to say a little something about what philosophy might have to say about some of these issues that in a lot of ways are scientific issues. They're medical issues, biological issues maybe. Well, then what does philosophy potentially have to say about any of this? So I'll run through just a really quick potted introduction to the topic of philosophy and what it is and what we're doing here, right? So philosophy is a discipline that looks directly at ideas. And ideas matter, right? Ideas, they shape the world we live in, right? I mean, we decide who lives and who dies on the basis of ideas sometimes. We decide who gets locked up and who doesn't on the basis of ideas. We decide what gets funded and what doesn't on the basis of ideas, right? What kinds of laws we're going to have or not have. I mean, all these things are built around these really fundamental ideas that collectively constitute this picture we have of the world, what it's like and where we are in it and how it works and how we can know about it. Right? But most people, most of the time, don't sit down and think too long and too hard about any of these ideas, right? People maybe think about them a little bit when they run into trouble, and then they realize pretty quickly it's pretty hard, and then they kind of think, oh, that's good enough for now. And maybe 9 times out of 10 it is good enough for now, until it's that 10th time, right? Until you get to the point where, well, wait a minute, what really should we say here? I mean, what are the guiding ideas? And the interesting thing that happens, and when philosophy starts to happen, is when you find that some of these things that I'm very sure of, these things I'm convinced are true, and these other things that I'm also sure of and that I'm also convinced are true, you lay them on the table in front of me and I look at them both and realize, oh no, they can't all be true. Like I'm wrong about something. And the question is what? And how do I go about figuring out which beliefs I should retain, which beliefs I should give up? Are these genuinely contradictory beliefs, or is maybe there's some kind of illusion here? Maybe if I thought about it a little more carefully, maybe there is a way in which these can all be true, right? This is where philosophy happens. So if I wanted to give a quick summary here. Let's see. That's not right. So philosophy is about making sense of our beliefs and commitments, right? So what do we ultimately think is true? What are our ultimate commitments? So what started me going here on this particular talk was this, it's a Times talk, so I'm looking into this particular article which caught my attention a little while ago here, by a writer who has a daughter with profound autism. I mean, she's nonverbal, and say she was speaking a little bit and interacting with things like she mentions here. She was trying to feed her Barbie little doll Cheerios, right? She was behaving like a normal child for a bit, and then she stopped, and then she regressed to the stage where she's probably never going to speak. She's virtually incapable of interacting in any kind of meaningful way with other people. There are, of course, she can make attempts at communication, but certainly not verbally. And it's very difficult to give her the help that she needs because she can't talk about what might be wrong or what her concerns might be. And very often engages in self-destructive behavior because she just has no other way of getting across to anybody that anything is wrong, right? And Robert F. Kennedy had said some, admittedly maybe some rather sweeping generalizations. Kennedy doesn't always get his science, he doesn't always have his science well grounded. Let's be really generous and put it that way, right? to be as nice as possible about this. And she's agreeing, yeah, Kennedy says a lot of stuff that's just nonsense, or that this isn't well, it's a lot of it's just quack medicine, or just stuff that's speculative, but he's presenting it as fact. But she says, nevertheless, she thinks, when he's talking about a certain number, not all of them, not most of them, but a certain number of children with autism are going to have these kinds of profound disabilities. I mean, maybe not most of them, but a certain number, not an insignificant number are, like her own daughter. And she says here, the title here, Kennedy described my daughter's reality. Maybe it's not the reality of most autistic children or parents of autistic children, but he says he described my daughter's reality. And there was some interesting discussion about some of the debates that occurred among the autism activism community, coming in and saying, criticizing Kennedy and those who might have supported him, for challenging the idea that autistic people that they want to say Kennedy's pointing out that some autistic people are at least suffering from profound disabilities, and some people were going after him for pointing this out. She said, well, why go after him for pointing out something that's true? He gets a lot of stuff really, really wrong. But he's right that a certain number of these kids do indeed have profound disabilities, and it's very difficult for them and their families, right? And their lives are very precarious as a result. So that got me thinking about this question. So, going back to the topic of philosophy, right? Philosophy, we're looking at our deepest ideas, and our deepest commitments, and our deepest beliefs. Well, the raw material that philosophy has to work with is the ideas that we generally accept in everyday life. I mean, one of the things that we would normally accept without even thinking about it, things that often just go without saying because we think they're just so obvious. You don't need to say them, and there's no point even pointing them out because everybody just instinctively believes them. Well, what would be one? Let's see here. One is just really simple. Disease, I'll use these words kind of interchangeably, although, yeah, disease, disorder, disability, these are different concepts. There are some different issues associated with each of them. But there are also some commonalities, and I think for my purposes here, the commonalities might be more important than the differences. If the differences are going to matter, we can talk about this. Oh, and I was going to mention at the outset too. I have a class at noon, so I'm out here at 11:50. I got to hustle at 11:50, so just kind of keep that in mind. I'll kind of remind myself of this as well. But in general, disease is a bad thing. If I sit here and just say to you, I'm just sitting here and say, I hope I don't get any diseases. I mean, what a weird thing to say. Not because you think it's wrong, but because that's so obviously right, why would you bother saying it? I hope I don't get sick. Yes, of course you hope you don't get sick. Of course you don't. That would not be a good thing. Of course it wouldn't. Or if I get sick, I hope there's some way to get over it. Of course I do. Who's going to say, I hope I'm sick forever? No one is going to say that. That would sound absurd. Or that disorder, a slightly more technical concept, right? It's a broader concept than disease. But if if something is a disorder, I hope I don't get it. I hope people don't come down with this. Well, of course you do. Of course I do. And why even bother pointing it out? Or disability, maybe a more complicated one, raises some slightly different issues. There are certain, according to some standards, you are disabled, right? There might be different standards, and there are interesting questions there. But I mean, it's thinking that in principle, this is something that we want to avoid. We want to. It would be rational. It would make sense to try to prevent these things. Like if there's some if I'm working on some medical breakthrough, and someone says, "Gosh, what are you working on over in the biology department?" And I say, well, I'm working on a way of preventing certain forms of disability. I mean, wouldn't everybody say, right on? That's what you should be doing? You want federal money? Well, right now might not be a really good time, but once we get things sorted out, want some federal money for doing that research to prevent disability? Of course, right? Or if disability does happen, maybe try to treat it. I remember after the actor Christopher Reeve, after he broke his neck in a fall in a horse riding accident, and he was paralyzed from the neck down. He was entirely paralyzed. And then he became a really, really visible disability activist, and he was raising a lot of money for cures for spinal disease. He always said, when he'd give these talks, he'd swear, I will walk again. And you know, nobody blinked. Of course he wants to walk. I mean, everybody thinks, yes, it's just obvious why he would. So it makes sense, and the key concept, in going back to these foundational ideas that we use to shape our lives, is health, or maybe slightly more technically, normal function. You want health. Health seems like we have a Department of Health, right? Seems like something worth having a department about, right? Health seems like a good thing. We want to promote health. Normal function, right? When Christopher Reeve was talking about maybe one day having his spinal injury repaired and being able to get up and walk around again like he'd been used to most of his life. You know, he wanted to be restored to what he understood to be his normal function. And these are the ideas that are guiding this. Well, that's one idea that we have. That's a base, you know, health or normal function. It functions as a baseline, and deviations from that in a certain direction anyway, we think of it as some kind of deficit. We call them maybe diseases, disorders, disabilities, right? Again, these are slightly different things. But there's some kind of deviation from this baseline concept of health or normal function. Which again, most of us, most of the time, don't think too much about. It just kind of is in the background. But then here's another idea that we all also share, and is just a part of our normal life, which is that belief too here, people are different. Of course they are, and again, hardly worth pointing that out in most contexts now, is it? Is it people are different? Like, yeah, you think, right? I mean, what? It's obvious, of course. People are different in all kinds of ways. You know, we have different sizes and shapes. We have different sex or gender, different preferences, different talents, different abilities. I mean, you name it. I mean, there's no test on which we're all going to come out the same. I mean, there's no. I mean, there's just not. And we don't think that's in principle a bad thing. It's like, well, people are different, and that's not a complaint. Right? That seems like it actually makes life a little more interesting. I mean, if we're all exactly the same, it seems like life would be in a lot of ways impoverished. Right? I mean, our lives are enriched by human difference. It makes the world in many ways better. It makes our society in many ways better. And it would not make sense. It wouldn't seem to be rational to try to prevent human difference as such. If I say I'm going to stamp out human difference, you think, what is wrong with you that you would think that? Why would you want to eliminate human differences? You want us all to come out exactly the same, like we're rolling off an assembly line. That seems like a really bad thing. Why would anybody think that will be a plus? Or the idea of treating, I put treat in scare quotes here. If I say I'm going to treat human difference, people say, what does that even mean? What do you mean you're going to treat human difference? There's nothing to treat. I mean, we're just different. Talk about treatment here just seems just off the map. It just seems like a totally weird thing to suggest. Maybe even an offensive thing to suggest. But of course, then this is the problem in putting these two beliefs together. One, we generally do think that things like disease and disorder are not positives. It would make sense to try to treat them, prevent them ideally. But difference, we don't think is necessarily a bad thing. Difference, on the contrary, makes a lot of good. Well, but of course, some of these differences count as disabilities, diseases, or disorders. I mean, that is a species. Those things are species of human difference. They're a kind of difference. So then the question that we run into, it's called, in the literature on this stuff, it's called, right, well, okay, I was going to say the key concept there is variation. Just that we're not, as human animals, we're not all exactly alike. Nor do we think we should be. So a major issue in the philosophy of disorder or disability is called the boundary problem. Which is, where does difference stop and disorder or disability begin? And just to take a really simple example of this, I'm really hoping in my heart of hearts that everybody in this room is literate. Hope we can all read in some fashion, right? But of course, as a college professor, I know for a fact that not everybody reads on the same level. Right? Some people are really good at it, some people not so good at it. Most people are average. You can do a nice bell curve probably if you graphed everybody's reading ability. Right? So we have this range of different reading abilities, like how quickly people can read, how good they are at decoding things, how good they are at figuring out meanings from context, stuff like that, right? And some people are better at it than others. Some people are better at sounding out new phonetics of new words than others, right? But at some point, people are bad enough at it that we say, all right, you have dyslexia. Right? And we call that a disorder. Dyslexia is a kind of disorder. Right? We say you're not only not that great at reading, your problems with reading are deep enough and systematic enough that we say there's actually something wrong with you. And we say this is a disorder, and we might talk about preventing dyslexia or treating dyslexia. That's just a very simple example, but when we have the spectrum, and we have this fine, imperceptible shading from really good, pretty good, so-so, average, maybe a little bit before average, pretty far below average, like what are you doing in college below average, and then finally we get to, there's something actually wrong with you. You have a problem that maybe you should see a doctor about. And like, well, where's the cutoff? And it seems like there isn't a cutoff for us to find. We have to invent one. We have to think of where we would draw the line and say, all right, now we're going to say your reading difficulties are bad enough that we're going to say you have a disability. And so that's the problem that you always run into, especially if you're talking about things like disorders that are syndromes, right? Where there's many of these cases, there's not one simple one-to-one cause, like, yeah, you have a viral infection as a result of a virus in your bloodstream, you have this particular condition, we'll give you some treatment and we'll get the virus out of your system and you'll be okay again, right? We're talking in many cases about syndromes that might have multiple biological causes, where there's no neat way of saying, well, this is what's going on in your brain, that's why you can't do this, that, or the other. I mean, there's any number of things that might be going on. Going back to the example, autism is almost certainly a syndrome, given what we do understand about it. There's a lot we don't understand about it. But given that there's this very broad autistic spectrum, and there's a wide range of different abilities that people with autism have, it seems very unlikely that there's just some one little thing that we can identify and say, there you go, that's the cause of autism. Probably not, no. I mean, there's probably a bunch of different factors that work together collectively. We get a wide range of different, but again, you get a spectrum, and where on the spectrum do you draw the line? Because probably even people with pretty severe cases of something like autism, probably no single thing they do is something that normal, quote unquote, normal people would not do. I mean, all of it is something that you say, yes, sometimes people do that. It's just that they do more of it. And they do less of the stuff that we might think of as quote unquote normal. And at some point we say, okay, you're not just an eccentric character, we think you have autism. And that's a medical diagnosis. Saying you're eccentric, that's not a medical diagnosis. That's just, that's just part of our everyday common vocabulary. But going from you're eccentric, maybe you're a little bit, you kind of march the beat of your own drum or do, I think you have a medical condition here. And we have a label for it that's in the diagnostic manuals, and you need a doctor to sign off. And I couldn't diagnose you with autism. You'd have to have a doctor, a medical doctor, do that. It requires supposedly medical expertise. I could call you eccentric, but I could not diagnose you with autism. I'm not qualified to do that, supposedly. And of course, this is a question you run across even with all kinds of maybe bodily disabilities, right? I mean, some people are more athletic than others, but at some point we might say, a failure of coordination might get to the point where we might say, we think that this is some kind of disability. But it becomes especially acute if you're talking about psychological questions, which of course with autism you are, right? And it's interesting to think about why that is. There's a lot of discussion of this. So looking at some philosophers who work in the areas of psychology and psychiatry, I was reading this article by Mohammed Abdullah Rashid from a couple of years ago. He says, the question is this: which aspects of human suffering, experience, and behavior are legitimate candidates for medical concepts and responses? Right? So some people have suggested that psychiatry as a discipline runs into trouble because they can't really define their domain. You talk to a dermatologist, like, what do you deal with? The skin. Right? I mean, in most cases, it's pretty straightforward. What is psychiatry or clinical psychology? What do they deal with? What is the domain? And it's kind of hard to pinpoint. And some people think this is a pretty serious problem for the discipline. If you can't tell me what exactly it is that you're treating, maybe this is an issue. And Rashid goes on to say, on that view, this view that psychiatry has trouble defining its domain, psychiatry trespasses into areas of life that have nothing to do with medicine, or more gravely engages in the management of social deviance under the cover of medical justification. Today, these issues are more commonly referred to as a typo, the problem of overdiagnosis and the medicalization of everyday life, but the concern remains the same. The boundaries of illness are blurred. Right, so he's talking there about the boundary problem, especially as it occurs in psychiatry or clinical psychology, which are particularly important. Along the same lines, this very important European writer on the subject, Ludger Terbarts van Elst, writing, psychiatry is a clinical discipline in the borderland between natural sciences and humanities. And I love that quote. That's why I want to get up there. I love that quote. Because he's right. It is. He's totally right. Psychiatric concepts of mental health and disease affect the self-image and self-worth of patients and their families in a very pervasive manner. Therefore, it is important to reflect on what we mean with psychiatric diagnoses, how we define it, and how we delineate phenomena we would regard as unusual but healthy from those we would consider reflecting a disease. So these two, they're not the only ones. I just thought these are a couple of really elegant quotes talking about the problem, the boundary problem. Where does, especially in psychology or psychiatry, where does eccentricity stop and psychiatric diagnosis begin? All right, so going back here. That brings us into the next part of the talk, as part of my title, the idea of identity. Because human animals, as social animals, as we have a kind of self-awareness that maybe other kinds of life do not have. We form this an identity, and this can mean a couple different things that are closely related in all kinds of interesting ways, right? One would be my self-identity, my image of who I am as a person. I can tell you something about who I am as a person. I've given this some thought. I have some ideas about myself. And part of that's going to involve where I fit in society. So part of my identity as an individual might depend on how I might associate with certain groups within my society. And so we get, well, the word kind of takes on a negative ring sometimes, although not always, but we talk about identity politics. Which is a thing. I mean, people say, well, people like me, we form a group, we have problems in common, maybe we can band together and kind of seek comfort with one another, and maybe if we have problems we could work on collectively, and maybe advocate for something that would be helpful for us as a group, as a distinct group that is in some ways different from other groups. And these are the questions of human identity. But of course, you get this point when differences can constitute identity. Well, that has to include disorders and disabilities as well. And you get people saying, well, as people with this disorder, we identify ourselves as a kind of minority group. Or people with certain kind. There are disability activists who often make the case that we have as a disabled community a distinctive culture of our own. And I wanted to show this particular example. They're now defunct, but about 20 years ago or so, we had a group out of Britain called Aspies for Freedom. People with Asperger's syndrome, right? Which a term which has now been clinically retired. A whole interesting story there. But this group, Aspies for Freedom, so there are people they were on the autism spectrum, and they were a political advocacy group. They petitioned the United Nations demanding recognition by the UN as a minority group. The UN recognizes minority groups around the world. And they said, we want people with autism to be recognized as a minority, like you recognize Uyghurs in China or something like that, as a minority. We want to be called a minority by the UN. And I'm not going to read the whole declaration here, but just some of the interesting points here. This is a declaration for the worldwide autism community that from here on we wish to be recognized with the British spelling as a minority group. And they said, well, why do they want this? They say, we want to direct a change from this type of bias against our natural differences. Natural differences, mind you. We talked about normal function, what they imply when they say natural differences, that maybe they're different, but this is not something that should be regarded as clinically abnormal. That's why they're using that language. And the poor treatment that can ensue thereof, of course. Their differences mean that they often are treated badly. the whole, so they talk about, yeah, what they need. People in the autism community have their own way of using language and communication that is different from the general population. That is one thing the UN picks up on when they say a minority group. If you have your own language, that would be one thing in your favor. Like if the Basque people in Europe say we have this Basque language which is totally different from anything else in Europe, that's one reason why they can say we are a distinct minority group. We're not French, we're not Spanish, we're not anything, we're Basque. That is what we are. And say, well, people with autism have their own distinctive, recognizable forms of communication. Why not call that our minority language? And they talk about the fact that autism spectrum seems, as they say, scientifically seems to be largely genetic and inheritable. So it's something that can be transmitted. Right? Like minority status generally can be transmitted. If you're born into a minority community, you are generally regarded as, by default, a member of that minority community. They talk about people on the autism spectrum having a unique social network, primarily text on the internet. Right? So it's saying we have our own distinctive ways of communicating. We have our own cultural differences, unique habits, such as stimming and different perspectives from the norm. We feel it is essential that this is recognized as these quote-unquote traits are the things that some children and adults are forced to stop by some harsh and intensive therapies. We should have the right to be ourselves without the pressure to conform and change our cultural differences. So they're making these things out to be cultural points, which I think should make them count as a cultural minority. Okay, and on that same line, so let's see here. Yeah, I don't want to go through all of their talk here, but it's really interesting stuff. I read a book a little while ago while researching this by an autism activist. He's a political correspondent for CNN, a man named Eric Garcia. He's a very successful person with moderate autism. It's been an issue in his life, but he's managed to get a degree from a good university, and he's a journalist, he's a political correspondent. He's had a good career. He wrote this book called We're Not Broken, which is about autistic people and their place in the world. And by the way, he casually says that autism is a disability. He refers to it as a disability, and he says it's like any other disability. But he is willing to say it is a disability. But he talks about, as a kid, he liked to watch MTV. And for a while there, back in the day, there were these ads. They got a bunch of rock stars advertising against autism. Like all these rock stars, and as a kid who liked MTV a lot, these rock stars that he liked were saying that autism was a terrible condition. It was as bad as cancer, and it was just destroying children. And he's looking back and like, well, why are these people telling me this? What's going on here? And I thought this quote was worth considering here. Now I watch that ad and think how corrosive it was to see Joe Perry and Steven Tyler of Aerosmith, whom I loved when I saw them live, say they wanted to wipe me out. Notice the shift there. They didn't say they wanted to wipe him out personally. They did not say that, I assure you. They said we want to wipe out autism. But what's he saying here? Autism is me. I am autism. Why does Aerosmith want to get rid of me? A good question, right? I think about the irony of the fact that Kiss, a band that taught me that being aggressively bombastic can be a good thing, saw autism as a disease on a par with cancer. Rob Halford of the band Judas Priest was an openly gay man. For me, he was the gateway to making a straight-laced church kid accept LGBTQ people. But while I imagine he would be deeply offended if anyone tried to cure him of homosexuality, there he was, advertising for a cure that made me, well, me. And so here we see his point that although he's willing to describe autism as a disability, he says, I have this disability, but this disability is part of what I am, it's part of who I am. In a way that when, it said Rob Halford said, we want to cure you, he said, well, you want to cure me of being me? And then what a strange idea. He's identifying himself with his disorder in this interesting way, which is why he says that, it's like they're saying they want to stamp out autism. He said, they want to stamp out me. Why would they want to do that? Okay. So as we see there, if you do identify with the community in this way, if you make the disorder or the disability part of your identity as an individual, as a member of the group, and then they hear people like that talking about treating or curing it, they can hear it as an attack on the group, or even in the case of Garcia, there a personal attack, an attack on him personally. So at best, failing to respect the dignity and worth of people with disorders and disabilities. At worst, a systematic aim to destroy them. I mean, the word eugenics starts to get tossed around here when they say, maybe we could find the genetic cause of autism and fix them at a time. And say, wait a minute, what are you saying exactly? You don't want any more autistic children to be born. Is this not eliminating a cultural group that you find offensive in some ways? Are we going back to just eugenics? And some people will start throwing these ideas around. Okay. So we got this here. Yeah, and this came up in that Times article that I was using as my basis here. To this. So Harvard's let's see, make sure I get the name right. The Beth Israel Deaconess Medical Center at Harvard, they held a panel a few years ago now on autism, on understanding autism, on medical research into autism. And in the panel, they were talking about looking for treatments for autism, or curing autism, or preventing autism. And there was a massive outcry. I mean, there was a petition that was circled that got many petitions. They had to withdraw. They ended the panel. They had to withdraw. They were planning on it. They didn't hold it. They apologized. And the woman who actually was circulating the petition, she said her name was Kristen B. King, and she said this. Talking about things like treating and curing autism is a really toxic narrative. There isn't anything wrong with being autistic, King said. That's something that autistic people have to say every day of their lives. So she's saying that there's nothing wrong with being autistic. But is autism a disorder? Wouldn't we normally think that disorder is not a good thing? I don't want to be disordered. We generally think that preventing disorder would be a good thing, but here we're saying that thinking is toxic. And the response, which was that article that I was using as kind of a basis for this, the woman who has a profoundly autistic child, she was responding and said this, and I thought this was worth considering. It feels incredibly condescending to be told by people whose experience with autism still allowed them to be students at Harvard that our children who cannot communicate if they have a stomach ache and might instead bang their head in distress are not having a negative experience, right? So she was quite annoyed that these kids at Harvard, Harvard students say, well, we have autism, but we can still go to Harvard and get degrees from some of the finest institutions in the world, and how toxic it is to talk about how bad autism is. Well, I mean, I'm dealing with a child who cannot communicate her distress, and often has to engage in self-destructive behaviors to try to get anything across to people around her, because that's the only thing she has to do. Right? Of course she thinks, of course there's a problem here. Maybe there are lots of autistic people are fine, and they can get degrees from Harvard. Not all of them, though, and she's making the point that it's not toxic to talk about that. Right? So the subject can't be verboten just because some people on the closer towards the middle of the bell curve on the spectrum are basically okay. And by the way, I want to point out that I'm using autism as an example, but it comes up all over the place. I read this a while ago on the BBC, some time ago. This is one of the things that got me thinking about this issue. There was an article about the use of cochlear implants to treat deafness. And some people in Britain, there were a few deaf people in Britain, particularly people who've been born deaf, were refusing to get cochlear implants because they thought it was culturally offensive. Right? Now, again, I'm not going to go over the whole thing here, but she's saying that the issue of cochlear implants and efforts to cure, notice the scare quotes, quote unquote, cure deafness, right, is a very sensitive subject among the 19,600 deaf teenagers in Great Britain. Many deaf people are proud of deaf culture. And she's mentioning this, I'm strongly in the deaf world, says Sarah, I'm passionate about it. I can't imagine myself outside of that world. I'm happy where I am. My parents brought me up deaf. Some deaf families do not agree with the procedure of getting cochlear implants and are defiant about remaining in the deaf world. They do not want treatment. They think talking about treatment is an offensive idea. Sarah and her family consider themselves to be very much part of the deaf community, probably of culture. Talking about there. For Sarah, it's not a case of just how unusual the implant would look, but how it would impact her sense of identity. Personally, I thank God I don't have a cochlear implant. I don't know where I would belong. I know I'm in the deaf world, but with a cochlear implant, I feel in between. It's offensive to think you can fix it. And partly she's talking about how primitive the technology is. That's partly what she's talking about. But of course, who knows where cochlear implants will go in another 20 years. I mean, the technology will presumably improve. I think her point is deeper than just, these things aren't that great medically. At some point we can improve them, sure. She says you can't fix it. If you're born deaf, you're deaf, that's it. And her boyfriend says, we find it offensive when people come in and say, oh, we can change you into a hearing person. That's why cochlear implants are a really sensitive issue for us. So many disability communities might say something along these lines. Right? The deaf communities have their own language, their own way of life, their own forms of communication, their own networks, and say, I can fix you. What? That's a really horrible thing to say about me. What do you think is wrong with you? Well, you're deaf. This is wrong with you. I said, yeah, but is that something wrong with you? I'm different. Is that difference a disorder that should be fixed? So to kind of sum up here, the fundamental issue, I'll leave you with it. I'm not going to answer any of these questions, by the way. What do you expect? But I'll say this. Are the concepts of health and normal function that are inherent in our concept of disease, if you're talking about disease, disorder, disability, if you're going to use those words, if you're going to think those thoughts, you must have a tacit idea about what health is. You must have a tacit idea about what normal function is. Are those value-neutral terms? Are those purely biological or statistical terms? Or are they at least in part, not entirely, some people claim entirely, I wouldn't go that far, but are they at least partly constituted by our ethical norms, what we think is valuable, what we think is important, what we think is good in life? And I'll leave you with this thought. From my point of view, it seems hard to avoid the conclusion that if health or normal function are by definition good things, if I say health, you think, yes, that sounds good. If I say normal function, you think, yeah, that sounds good too. If those are by definition good things, then health or normal function they have to be in part ethically normative ideas. They're not purely biological, which is why you couldn't build a health detector. Right? You can't run a test. You can test for a viral infection, you can't test for health. Why is that? Because it's partly a normative idea. These are philosophical questions requiring not better scientific tests or more sensitive instruments, but humanistic reflection on what a good life would have to involve. These are questions about the good life, is what they are. Partly biological, but it's biology as it affects the good life. And what do we mean by a good life, and what people can justly demand from others in terms of accommodation. Right? Those are questions about justice tied inescapably to questions about the good life. That is not biology anymore, that's philosophy. And that is where I will leave you. We have a little bit of time left. You want to have some discussion? Saw that coming, yes.
Excellent presentation. Yeah, and a lot of the great, really interesting things are laid out here for us to all reflect on.
Yeah.
One of the things I would ask is, when we trapped ourselves a little bit, or biased the question by putting it like on a continuum. It's like it's on a line where the lines measure the same thing. I weigh this much or I weigh this much more. It's the same thing I'm looking at. But maybe what we have with disorders and things like that, like, okay, how well do you see? Okay, you've got to see. If the root cause of it is fundamentally different, if we say, okay, you don't read so well, the example you gave, but you could be at this point and this point, and the reason for it is not something we could put on any kind of straight line. But it's the kind of thing that has such different fundamental root causes.
Yeah.
We say, well, you haven't started yet.
Yeah.
Nobody taught you to read when you were 4 years old, and okay, you just raised by wolves, whatever. That person doesn't have something that prevents them from reading later. So there's a different explanation and a different way to deal with that if they want to.
Yeah.
Another fundamental question, I think, is lurking underneath or around and permeates this whole thing is, who decides, and can you decide for someone else? We generally accept the principle that people can do things, make their decisions if it only impacts themselves. Like a deaf person says, I don't want cochlear implants. Are we going to force them on them? That seems like a bridge too far for most people. But think of the question where, oh, people who are deaf maybe, or maybe they just embrace deaf culture. You could even push that. I want to give you a scenario. People who can perfectly well hear purposely damage the hearing capabilities of their newborn child. Is that okay? Their child, they can say, no, nothing wrong with being deaf, so you can't do anything, you can't prosecute me, you can't take my child away from me, you can't call Child Protective Services because I've harmed my child, because there's no harm done. Would you accept that? Because there are logical implications to some of these consequences, which is what David has laid out for us nicely, and that's where you can now see them in the context of the questions he has. Thank you.
Yeah, and of course this talk was entirely inadequate. I'm well aware of this. These issues are massive and very deep. This is why I was kind of reluctant to do this in the first place. Like, this issue is massive. I'm not going to do it justice. But sometimes, yes, skimming the surface is still a good thing to do. If people don't spend a lot of time skimming the surface, maybe it's worth doing that. But yeah, I mean, that's absolutely right, of course. Yeah, and yeah, you're right. There are all kinds of ideas matter. That was my starting point. Ideas do matter. I mean, this stuff has real world implications. I mean, people think that philosophy might not have any real world implications. Oh, it does. You just often don't see them if you aren't aware of them. Yeah, if we say that deafness is not harm, yeah, what if I deliberately deafen my child? I mean, yeah, I don't think too many people will be on board with that one. Yes?
I find this discussion fascinating. The whole idea of deaf culture and the whole idea of the cultural differences between communities is rather artificial and created by society itself. And it is due to the fact that the person has a hearing loss or deafness, and it is a way of dividing people into categories and limiting economic, social, and political opportunities in life. I can give you another example of polio was everywhere in the 50s and 40s and 30s and 20s. And Franklin Delano Roosevelt had polio when he became president of the United States. Now, the story is that he never exposed himself to being in a wheelchair. He never did that. He hated to have his picture taken in a wheelchair because it meant it diminished his power as president. It meant he was an invalid and not president. Now, the whole idea is that, from your perspective, I understand the argument about autism or whatever, because my nephew has autism, he's on both, okay? And I think I have some autistic tendencies myself. But the whole idea here is that if you have a disease, a disability, and whatever, and you say polio, for example, why not polio? You said, well, people with polio, said, don't wipe out polio. It's on disability, it's on identity. The whole thing doesn't make sense because you have a disability or disease or condition that is somewhat amenable to correction. What I mean by correction, you can at least treat it to cause less pain, less suffering, and less future economic damage. My girlfriend Becky here, she's an example of someone who I say exemplifies the economics of it all. The Vocational Rehabilitation Services of Kansas signed a contract to give her a van, fix her van up for her so she could get around. $47,000 contract for one modification of van. Now, that's the economic cost of disability. In addition, wheelchairs, scooters, hearing aids, glasses, whatever, and medical treatments are cost of disability, economic cost of disability. Now, you got to balance that against the philosophical value of human life versus the economic cost of disability. And at least in some cases, you can justify the idea of funding services, and you gotta make choices. Who do you fund and what do you fund? I think the issue here is you have people with disabilities and you have people supposedly without disabilities. We all have disabilities. All of us have disabilities. We just don't really recognize it yet. We don't think we have a disability. We can walk, talk, stand up, move around, stuff. But we have a disability. It's just invisible. It may be a sight disability, it may be a mental disability, it may be a sociological disability, and disability. So all this is part of the social condition of humanity.
Yeah, I mean, all that seems right. I mean, that these categories, like I say, if the lines are blurry, you draw them somewhere. And so we don't find the lines, we draw the lines. And one of the reasons we might draw the lines, I mean, yeah, it is the economic stuff. I mean, we might say if something is very costly, we might call that a disability, and then we have to decide whether or not we're going to fund accommodation for something like that, which may not be cheap.
Right, exactly. And the political part of it is that for many years, people with disabilities have not been able to vote. They've been shut out of the political process, they've been shut out of the social process, we've been shut out of the economic process. We still are shut out of the economic process. Around 70% of people in the United States with disabilities are unemployed. It's what this get underemployed. But that's an economic process right there.
Yeah, and if we decide that's an injustice, and off the top of my head, I'm inclined to think that it is, then it might be on us to do something about it. I mean, which, that would be the philosophical lesson to draw there. A couple more minutes, and then I got to hustle. Yeah.
On the issue of autism, with the one, with the people talking about how well, this is excluding me. There's a lot of different ways you can break this down, but one point I'd like to make is definitionally, that term is just so broad currently, right? There's a high degree of, they call them high functioning autistic people, and you meet those folks. They're very skilled at specific tasks. They can take care of themselves. Balance a checkbook. Yeah, you would think, why would I want to cure that? That's fine, but then there's a point at which it's well, this autistic person can't communicate. They need 24-hour monitoring. They couldn't be left alone to manage money, take care of themselves. So I think at some point you're gonna say well, there's a degree to which this becomes problematic.
Yeah, and there are autism in particular. That a lot of people are arguing that they're reading some articles on that the term is just unhelpfully broad. Mm-hmm. And that they retire the term Asperger's, but then some people are thinking maybe that was a mistake. Maybe that is a distinction we do want to draw, because that would at least get more the high functioning level versus people who just really have a very hard time functioning at all. And the demand for diagnosis is a kind of recognition of the specific problems this specific group has, which might not be the ones these people have. So again, we're drawing the lines. We want to draw the lines in places that are helpful instead of unhelpful. Anything else? Rotten tomatoes? That's all I got. That's all you got. So, right?